joining Aesthetics and Skin's Institute Lunch and Learn webinar today. So as you know, the topic is understanding the science of treating aging skin. We were expecting about 60 people today, but it looks like they might join a bit later. So we're going to have more of these webinars in the coming months, coming weeks. So this will be actually good for everyone to learn during lunch. We'll keep it short, keep it brief. My name is John Tam, and I'll be a facilitator for the webinar. I'm the system administrator for our learning management system, and also your first point of contact if you have any questions regarding our courses and technical questions. Okay, so when you call our help desk. Before we begin, just some housekeeping webinar guidelines. Most of the time, it's basically keeping yourself on mute and also your video off if possible. And we're going to have this meeting recorded as well, so that at the end you get a link to the session. We're trying to aim for our 30-minute allocated time slot that we've mentioned earlier. The webinar is actually run in two parts. So Dr. Ben Chan will be presenting in the first 20 minutes, and then we'll have a Q&A. So we've got some questions that some people have already asked us from registration, so we'll get those addressed as well. And if you have any questions during the presentation, please use the chat. So on the bottom, you'll see a chat button. You can actually ask the questions there, and I'll ask the questions at the end to Dr. Chan. Okay. Quick introduction about Dr. Chan. He's actually the medical director of the Aesthetics and Skin Institute, which is also known as Cosmetic Institute of Australia. Dr. Ben Chan is an experienced entrepreneur, medical doctor since 1984, and a visionary in the cosmetic skin fields. For over 35 years, he has pushed the boundaries of aesthetic medicine in Australia and beyond, and is a respected cosmetic educator for doctors, nurses, and therapists. He is well known within the industry due to his experience in treating skin conditions and providing aesthetics procedures. So Dr. Ben Chan, over to you. You can start your presentation. Thank you.
And thank you and welcome everyone. So, and this is about understanding the science of treating aging skin. Now, I love teaching, as most of you already know, and I've written and recorded a lot of these, and these are available online. I like to simplify things because I think that in the market, there's too much confusion out there. And a lot of us, including myself, have been buying things and things we don't understand, and eventually find out we don't need. Is not in line with what we're trying to do, or it gets too complicated. So the outline of today's talk is defining our objectives, and then define our scope. And we need to know what happens when we age, because if we don't know, then we won't know what to deal with it. And then breaking it down and then putting all together, and a short brief about where do you start. Now, I have to assume that most of us here have the experience of treating skin, but let's break it down to basics. That's what I want to do. So the primary objective of treating someone with aging skin is, of course, getting them to look fresh and healthy looking. The secondary objectives are, we know that there is a demand, and the demand is not so much in fixing things, but rejuvenation, and they want to achieve results. Now, is this results-driven focus that brings clients satisfaction and brings career satisfaction as well? So never forget about wanting to get results, and I believe almost everyone here would want to get results rather than just selling products or services. Let's define our scope. Well, I have my own scope, you have your scope, but for the purpose of this talk, we're talking about rejuvenation and maintenance. We're not talking about specific skin conditions like treating melasma, although there has been a question about it. I will address that. So we're not talking about treating milias and acne scars. So we're talking about rejuvenation and maintenance. As mentioned earlier, this is actually a big part of our work. From our own research in our clinics, I think it's about 80%, and only 20% come with problems. But most people just want to look young and healthy. So it needs to set up a simple, effective, and inexperienced strategy for us to deliver results. So we're not talking about expensive equipment here. Let's go back to what happens when we age. So no doubt this picture shows changes in skin as well as other areas which don't concern us. But we're addressing or focusing on skin at the moment. Aging begins somewhere around 25, and it accelerates, unfortunately for women, after menopause. Men goes slow and steady. There is no such acceleration. So why this is important is because you need to appreciate that those people, patients or clients after menopause, you need to be a lot more aggressive, especially if they have not been looking after themselves. And those who are beginning late 20s, they should start looking at preventative things to keep their skin nice and young. So we already know that there are factors that accelerate and which are preventable, such as smoking and sun exposure. There's a lot more, but these are the two that we need to highlight and is almost common sense. And the visible signs of aging, look, there are a lot. These include fine lines, wrinkles, irregular pigmentations, which we know of. So I'm not going to tell you the things that we already know, but I'm going to tell you the things that you may not know. And this is as a result of cellular level, right? Without getting too scientific, and I'm not one for details anyway. So we know that the skin, as we age, it increases its dead cells on top, and then there's less cell turnover. And also there's a reduction in collagen and elastin. And this is, the other component is the HA, the hyaluronic acid. So when we look at the skin here, so the things to focus on is that there is an increase in level of thickness called the stratum corneum. There's a lot of piling of dead cells as if nobody's cleaned the face. And then there is the reduction in collagen and elastin fibers. And then those blue dots there, these are the hyaluronic acid, which is present in the epidermis and dermis. So they are also reduced. So what does the collagen and elastin do? It keeps our skin firm and tight. And the HA, the hyaluronic acid in the water, it binds the water in the epidermis and dermis. So therefore, it increases our moisturizing. So it sounds very complicated. I'm speaking very fast, but now I'm going to slow it down and breaking it down. So most of the things I mentioned, you would have already known. So how do we come to make things simple? We don't have to be so complicated understanding so many products and treatments. We just need to understand what we're doing. What are our targets? There are only 4 targets that you need to know. So whenever you do a skin treatment or prescribe a skincare, you only need to know these 4 things. So not your complicated formula that's looking for magic cream. Just look at these 4 things. That's the science that comes in. The keratinocytes, these are the cells in the epidermis. And look at the melanocytes, the fibroblasts, and the HA. That's all I need you to concentrate on. Just focusing on these 4 things, and that's where we start. So let's describe the first group, the keratinocytes. The top layer of the keratinocytes is the stratum corneum, which is the dead cells. And this is a barrier. This is why when we go swimming, we don't get drowned. We don't get absorb the chlorine that's there. So the stratum corneum, being a barrier, has its function, so it reduces absorption of chemicals. On the flip side, this also reduces absorption of what we intend to give them, like moisturizers or active ingredients, whatever serum you want to give them. The stratum corneum is the barrier that makes sure that the patient or client is not going to absorb as much as they would like. And what we need to do is to reduce the stratum corneum so that it enhances our absorption of whatever you intend to give them. Moreover, you need to stimulate and increase the turnover of the cells so that the skin appears healthy and glowing. So this is our primary objective in treating keratinocytes. What about the keratinocytes that we can do in our clinics? Well, number 1 is microdermabrasion. Yes, it is an old sort of, is something that's been present for 20 years now. The microdermabrasion is very important to reduce the stratum corneum so that it enhances the ingredients that you prescribe for your clients, whatever serum that you're using. So it removes the top layer of the stratum corneum. It was been touted as a collagen induction therapy. Now, we have better ways to cause collagen induction. We'll see that in the next few slides. So no, I don't promote it as a collagen induction. Yeah, you can do it, but it doesn't do it that well. So primary function is to reduce the stratum corneum. Getting rid of the dead skin, it stimulates it. There will be an increase in turnover the keratinocytes. Yes, one can do peels. This will be the topic of the next discussion. Peels, again, depends on what you're peeling. So the medicine in there is important. And of course, you can go super expensive and do erbium lasers or chemical laser peels, but that is totally not necessary if you have microdermabrasion and supplemented with a peel if you need to. Now, what do you do at home with the keratinocytes? So the keratinocytes, you can use simple agents such as the alpha hydroxylate acid or BHA, depending on it. One of my favorite ones is glycolic acid. It's simple, it's effective, it gives the skin a glow, and we know for 30 something odd years now, it plumps up the cells. So we are targeting the keratinocytes. So ultimately, we are trying to increase the turnover and plump up the cells. So that's the first thing. You need to look at the in-house and the home management. Let's look at the melanocytes. Sure, this is particularly important in darker skin types because we get tan unevenly. So you do need to control the pigmentation. There are many pathways to control the melanocytes. We don't need to be professorial material here, just to understand that one of the commonest thing is using a tyrosinase inhibitor that's inhibit the production of melanin. Now, none of this is any good if someone goes out sun tanning. So the effect is not really making them whiter, but it's to blend in. So we do need in our repertoire, in our arsenal, we do need to have something to control the function of the melanocytes. So what can we do in the clinic? We can do skin needling with some active serum. Skin needling itself does not do much to the melanocyte. Yes, it's been touted for vitiligo and hyperpigmentation, but that's not it. You need to use skin needling together with active serum, something that addresses the melanocyte. Of course, you can do peels. Again, peels is another topic, but you can use peels that have active ingredient that monitors that controls the melanocytes. And home management is as important. Of course, here we are. I just mentioned the tyrosinase inhibitor. It doesn't need hydroquinone. You can use simple things like kojic acid. So again, when we look at certain things like kojic acid, what do we do? It's not what the reps tell us. Yeah, I can do this, this, and that. But actually, I'm looking to using kojic acid to regulate the melanocyte. So again, coming back to my principle of targeting the important cells. Stimulating fibroblasts. Well, that is something, as we know, sagging is number 2 concern of after wrinkles and so on. But what can we do? Well, we can stimulate the fibroblasts and to produce collagen and elastin at the level of the skin. So in the clinic, nothing is more effective than skin needling. If we talk about lifting and all that, we talk about HIFU at a later stage, but we're not talking about lifting. We're talking about producing collagen and elastin. If we talk about maintenance, skin needling is highly effective. And at some stage, I will talk about microneedle RF, but a simple device such as skin needling is enough. It's enough to cause collagen and elastin stimulation. Moreover, the skin needling pricks the skin and allows better absorption of some of the active ingredients you are supposed to add. So you can do skin needling, it does collagen induction, and also it enhances the absorption of the active ingredients, maybe cream or serum. So home management, of course, you need to repair after you've re-injured the skin in a controlled way. And lastly, we talk about the HA. HA cannot be neglected. The main purpose of HA, these molecules simply hold water and absorbs water. And without that, the skin will just be dry. So what can we do in the clinic? We can use skin healing and apply HA, or you can apply HA products for the treatment of HA. So in summary, this is related to science. You stimulate the keratinocytes, you reduce the thickness of the dead skin, you manage the melanocytes, you stimulate the fibroblasts, and you replenish the HA. And then, of course, you need to protect from the sun and so on. So how do we put this together? I need to stress the importance of in-clinic and home management as a partnership. The importance of in-clinic treatment, you provide the patient with a proper assessment. So many patients or clients will just walk past the airport duty-free and just pick up products. As you know, it is not as effective and is totally inefficient. So when you bring the client in, you give them an individualized management plan. It saves them a lot of time and money to achieve the results that they want. And the home management, of course, is important because it's a continuation of what you do in the clinic. You can't possibly go and see a dentist every year and not brush your teeth. So the protection and prevention is important. So how do we get there? You select the most effective creams and serum according to the targets rather than, oh, I can use this cream and I can fix wrinkles. Now, let's move the thinking. What targets are they addressing? Is it just fixing the wrinkles or fixing keratinocytes? Let's be clear. So the purpose of education is to know what we're trying to fix, and because the origin is in the cellular level, the origin is not in the wrinkles and macro level. So we need to, once you find that you are targeting those cells, everything will follow on. So we'll combine with simple tools such as microdermabrasion and skin healing, you are already starting to deliver results. Where do I start from here? First of all, this is almost an introductory to skin treatments. Whatever level or whatever your clinic is, whether it's a bigger clinic or small clinic, it doesn't really matter. Is you yourself have to define your role. You also define your scope of what you can do. And you need to understand what and why. So of course, you need to understand a bit of skin science. And I've already touched on that. There are only 4 things that you need to do, which is the focus on the target. So it's not that complicated. And then formulate an assessment plan, and follow-up means you take care of the client and not just sell a product and say, see you later, bye. So you do give the client a proper assessment and then a management plan. You cannot fix everything in one visit. So give them a treatment plan so they know what they are looking for. So just a brief thing about vitamin A, vitamin C. Yes, we hear vitamin A is good for wrinkles and vitamin C is good for that. Sure, they are good, but they are not your basic fundamental ingredients. Yeah, because if you want to yes, vitamin A also works on keratinocytes. Well, which one is better? AHA or vitamin A? And which one is simpler? Which one is going to show me faster results? So again, hone in on the target cells, get your results, and these become complementary or supplementary. Yes, vitamin C is good for pigmentation. My God, it's going to take ages to get there. And it's good for collagen and so on. You're not going to see results. And we want to see visible results so the patient gains trust. And that's what makes you do what you want to do. So these are amazing results, no doubt. But these can only be seen as supplementary. So whenever you see a rep selling you or looking at a skin line, you don't need to have 10 products. You need the ones that really work on the 4 targets I've given you. Formulate your treatment, and then you see the results, and the results show. It sells itself. Don't have too many overlapping ingredients. Do I use vitamin A? Do I vitamin C? And throw on. You throw in, and you've already lost focus on what you're trying to do. Have a simple system. For those who have not haven't started at all, have a simple system. Focus on the four things I've talked about. Know it well, then confidently build results, and then gradually expand to other machines or treatment. But patients come in, you don't get many chances. They're not going to want to see results 3 years into the track, 3 years down the road. They want to see results fairly quick. Okay, they want to see it fairly quick, within few weeks. So go back to the basics. Once you see the results, once they gain the trust that you are actually doing good to their skin, they will sing you song. So they will bring clients in, and that is what you wake up for. So stick to simple machinery, give them the results, then you complement other things. But know that the purpose of this talk, talk, and also the focus is a patient coming in looking after the skin. I'm not talking about lifting and all that. The patient just want, these are clients, which is 80%, just want to have a good looking skin. So start with that. Go for the essential and effective things and combine these to work. So in closing, most of these topics are already online, and I do love your questions. You can contact me or John anytime. Is when you ask me questions, then I start writing all this stuff, which is a lot already. The future topics, these are the ones that have been asked of me. And John, you have a few questions to ask me?
Thank you, Dr. Chan. So we've got some questions from people who have registered. And one of the questions, Dr. Chan, is best treatment for melasma.
Okay, best treatment for melasma, I will write that out as a module. We'll probably load it on the YouTube or somewhere. It is complicated because I have even seen many people calling melasma when it's not melasma, so that becomes a problem. And it does require another address, like maybe half an hour, because even in this clinic, when we treat melasma, we do have a special consent to say that during the treatment, they can even get worse despite, you know, the treatment is because it is a medical condition. It is not, it is, you know, they continue to get worse. It will continue to chase them. So we do have special consent, even for melasma. They need to understand what we're trying to do before that. So I will address that. I will address that in a separate module.
Thank you. Another question is, if we have to buy one machine, what will be the best machine?
I've already mentioned the two essential, which is the microdermabrasion and also the skin needling. I would assume everyone would have LED, best for skin healing. If I have to talk about LED, it only takes me 5 minutes, so it's not much talk there. LED. And beyond that, probably micro needle RF. Now you're putting me on the spot, but I think that this is a workhorse for us. I say that because you can deal with a lot of common skin condition. Yes, I will make a special address on micro needle RF. In fact, next week I'm giving a talk on Surgitron. It's the same company that makes a micro needle RF called Vivace, and I have presented for them many times, but I can make this a special module on this one. So let's go back. It's a skin needling, microdermabrasion with or without hydration. I don't think it makes that much difference. It's the active ingredient that you put in the microdermabrasion that makes a difference, not the hydration. It feels good, so get it if it's not too much. Then the next step will be LED. You should have LED, and then micro needle RF.
Thank you. Anatomy points.
That one is more for fillers. Skin anatomy, which I've briefly written up there already, but any more anatomy, I need to know what it is here. So we have an entire section on fillers for anatomy.
Okay, thank you, Dr. Chan. So I didn't notice there was no questions in the chat. Is there anyone, we've got a few minutes spare. Is there any questions anyone would like to address? If you can just raise your hand, I suppose in the Zoom, you can put your hand, we can actually unmute you if you have a question, or you can just type it into the chat below. Like there's a little button there that says chat. We've got a few minutes to answer any of your questions.
Okay, whilst you're waiting, if there's a question anyway, there is one who say, how do you restore collagen in aging skin? So that's what I've talked about already, using the micro needling, the skin needling for the collagen induction. and elastin induction. Do you need microneedle RF to do that? Probably not. The microneedle RF we use for slightly different function. It is a turbocharged skin needling, but just for the purpose of collagen and elastin induction, I don't need microneedle RF. I think the normal skin needling is good enough. But in terms of lifts, that is the next one. That is something that therapists, nurses, or doctors can do. That is no longer talking about collagen and elastin at that level. So that one you're talking about way below the skin, which is called the SMES level. I will address that as well because the sagging is such a common thing, and the available machines out there at the moment, the two well-known ones are the HIFU and the radio frequency, and then the third player has come along. It's called the HEAT one. I suddenly can't remember the name of the brand, but the HIFU is the high intensity focused ultrasound. There are well-known brands out there, and then there is the radio frequency and then the HEAT. So these are to do with the sagging, and it is within the scope of the therapists, nurses, and doctors to do this sort of lift without threats.
Okay. It doesn't look like there's any questions. I haven't had any other questions. Anyone? Any?
Good. I must have addressed it well then.
Okay.
So the next talk is going to be on skin peels. Just to preempt you, yes, there are a lot of peels, and again, we're talking about different medicine in the different peels. It is important to know what is in the peel, and again, don't look at the peel. You can do this. You can remove the pigmentation. Again, ask what is the target? What am I doing? Why do I need that? And if you can use the right peel, which contains the right medicine, your clients will be so happy. Thank you for listening.
Okay, thank you everyone. So this concludes our webinar for this session. Stay tuned on social media. So you'll on Facebook. If you're not part of it, please join us on Facebook, Instagram, and our weekly newsletters. So from there, you'll see us posting new modules, which we've got released in the coming weeks. And hope to see you guys in another one of our webinars. So thank you very much for your time.
Make sure you visit our website and sign up to our exciting and informative injectable and skin courses and more.